Hi, welcome. This is Dr. John DeMartini. This is one of the most amazing and inspiring shows that you can listen into. If you want to be on the edge of your seats, if you want to open up your heart, if you want to expand your mind, and you want to meet incredible people, stay tuned because you're just about to experience a transformative radio show that will change your life. And you're listening to the Dr. Pat Show that's coming up right next.
The following audio is via a Skype call.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail.
Welcome, everyone. Welcome. We've got a great segment for you today. Lots of information. Joining me here today is Seema Verma, who, as administrator of CMS, Ms. Verma oversees one of the largest federal agencies that administers vital healthcare programs to over 100 million Americans. Before becoming CMS administrator, she was president, CEO, and founder of SVC Inc., a national health policy consulting company. For over 20 years, Ms. Verma has worked extensively on a large variety of policy and strategic projects involving Medicaid, insurance, public health, working with governors' offices, state Medicare agencies, state health departments, state departments of insurance, as well as the federal government, private companies, and foundations. Seema, welcome to the show. Today's topic and what we're going to be talking about today has to do with the International Pricing Index model and how HHS advances the payment model to lower drug costs for patients. So the International Pricing Index model would lower the cost for physician-administered drugs by resetting Medicare payments based on international prices and introducing competition. A lot's going on in the news right now, and so I think there are a couple of things. Seema, first of all, let's get an update from you about the latest, greatest breaking news that you want to share with us today.
Well, I'm very excited to tell you about President Trump's plans to lower drug costs for America's seniors on the Medicare program. So a little bit of background. We released a report yesterday, and essentially what that report did is it compared prices for the most costly physician-administered drugs that are covered and paid for Medicare Part B. So that's the part of the Medicare program that pays for drugs in your physician's office or in a hospital, outpatient department. And so we compared these prices to other countries with similar economic conditions. And what the report found was that on average, the United States is paying 180% more, and in some cases more than 400% more than the international average. So that means that we are paying more. And this really has to do with the perverse incentives within the Medicare program and how it's set up. So essentially in the Part B program, there's no negotiation. We are essentially price takers. Pharma sets the price, and American taxpayers just pay that. We don't see the types of discounts that we see in the Part D program or in drugs that you get at the pharmacy counter. So we're not getting any discounts. And what this report showed was that they're actually giving the same drugs overseas at a lower cost. And so what the president did is he's been very committed about this issue, very concerned about the high cost of prescription drugs. And he's been working on a variety of different initiatives. But this particular one, I think, is very important because it's going to have a direct impact on our Medicare beneficiaries. And the idea here is that we're going to phase in the Medicare payment for these drugs to more closely align with international prices. So over a 5-year period, we're going to phase in the discounts that they're providing overseas, and we're going to start providing them within the Medicare program.
Okay.
And over that 5-year period, we'll see a 30% discount over those 5 years at a savings of $17.2 billion for taxpayers, and that's $3.4 billion for seniors.
Okay, so let's just be clear. We're talking about Part B. Is that B as in boy?
It's B as in boy. So
Thank
these
you.
are what we call physician-administered drugs. It could be for people that are undergoing chemotherapy or some type of infusion where they actually go into the doctor's office or a
Right.
hospital outpatient department to get these types of drugs.
So basically, the sickest people we have in the United States are going to be hit the most. And I'll tell you what, let me just say where I'm coming from on this, and I'd love to hear your side of it, because we have been trying to get the report that you're referring to so that we could look at the countries. Let me just bring it to the forefront so my listeners don't think I've lost my mind. We did an entire series on Part B. We did an entire series on the people that get these infusions. Let me give you the short version. Lupus, Lyme disease, rheumatoid arthritis, ALS, cancer, every form of cancer. All of the worst possible diseases a person could get are part of getting drugs in their doctor's offices. And let me tell you why. Because we just can't go to the hospital to do it. So I just want to be clear about this. The other thing that my listeners have already responded to, I'm telling you, I've been on the internet all day today with this. So fortunately, I'm so glad you're here to answer. The analysis that were done with the countries, here's my question for you and President Trump. When you look at the countries that you just, you all did the report on, please look and find, if you would, the pharmaceutical industry in the United States charges those countries less. So the question that my listeners have for you today is, why don't we just get the pharmaceutical companies that reduce these prices to these countries? And by the way, I couldn't tell from your report if you compared the quality, because a lot of these drugs that we send abroad are not tested or not up to the same standard we are. So you see, this is a complex issue, and I really commend you for taking it on. But it kind of is not making sense to my listeners. I'm already getting beat up, and I haven't even done a show on this yet today.
Well, I appreciate your question. So let me try to unpack some of those.
Thank
so the
you.
first one is that you talked about this being, some of the sickest patients, and you're exactly right. And that's why the president is working to lower their out-of-pocket expenses for the medications that they have to take. So it's going to hit them in terms of their pocketbooks. They're going to actually be paying less for their medications because they have to pay 20% coinsurance on their cost of their drugs. So this is actually going to lower their costs. You sort of talked about, why is this going on? Well, that's the way the Medicare program, unfortunately, is set up. It creates this perverse incentive. And these are the exact same medications. A lot of them are even manufactured here. The exact same medications are being offered overseas at a much lower price. And so what the president is saying is that's not fair to our taxpayers. It's not fair to America's seniors that are shouldering the extra cost or having to pay for innovation and research for the entire world. And that's not fair. And we want to put America's patients first, and they shouldn't have to shoulder this burden. Yeah. And that other countries need to pay their fair share of research and development. And we can't be it's just not fair. And what we want to do is lower the out-of-pocket expenses for America's seniors that do rely on these medications.
Yeah, so I love to get back to this because this is really important that people understand your perspective as well. Number one, the question that came in from Jody from Pennsylvania is, and this is like before, could you tell us the countries that were used in the research? And of the countries that were used in the research, could you please tell us which ones have universal health care? So, for example, if you use Canada, or if you use Australia, if you use some of these countries, right, that's a different scenario. So that was Jody. Then I got a question from Idaho that came in and asked the question, no, this is not a question, this is a statement. I've got a better solution. Take back the tax cuts and don't cut Medicare and Medicaid. And why aren't we imposing a tariff on pharmaceutical companies that simply don't get in line? So you see how the average citizen here is saying, wait a minute, why do people 65 years and older have to take the hit on this? Why don't you just go back to the pharmaceutical companies and say, folks, you need to stop? You got to stop.
Well, I think that's exactly what we're doing, right? What we're saying is it's not fair, and we're saying to pharma, we're not going to let you continue to do that. So if you're giving discounts overseas, then we want to make sure that Americans are getting those discounts. That's exactly what we're telling. That's exactly what we're telling pharma. So we've looked at the cost of drugs in other developed countries: Austria, Belgium, Canada, Finland, France, Germany, Greece, Ireland, and a variety of different countries. And we've compared those prices, and they're giving better deals to people overseas. And that's exactly what we're saying, is that we're not going to continue that anymore. If you're offering lower priced drugs overseas, we're going to phase in the discounts that you're providing to other countries. And we're going to phase those in so that American seniors are going to pay less and American taxpayers are going to pay less. That's exactly what we're doing.
Right, but you're not really getting at the real issue. For example, the United States imports only 25% of its drugs. What if the United States would truly add a competitive base to this company, just like the president has done all along? I mean, I'm on your side with this. I mean, if you're looking at hitting up tariffs and going after the UN and saying you people haven't paid your fair share, the best way to get at this, and we've seen it through breaking up monopolies like the telephone company, is to say, wait a minute, we are going to import these drugs from these countries that are producing them at a 52% reduction, and we're going to bring them in here tariff-free, and we're going to let patients choose. You see how that doesn't affect us that need the drugs, that are people over 65? So isn't that like a super solution that we could do, rather than try to make up the tax cut deficit by cutting Medicare? That is a lot of money.
Well, first of all, we're not cutting. Right? First of all, we're not cutting Medicare at all. The president has done everything that he can do to strengthen this program. If you look at what we've done in the Medicare Advantage program, we've actually increased benefits, provided more supplemental benefits.
Okay. Well,
we've lowered premiums by 6%.
I have to apologize for that misinformation. I'm only reading what's on the news today, so somebody should straighten these news people out.
Well, I appreciate that, and that's what I'm hoping to do today. Everything that we've done is about strengthening the programs. We haven't cut services at all. What we are doing is making sure that seniors are saving money. We've actually lowered premiums for the first time in 5 years. So everything that we've been doing has been structured around strengthening the program. And what we're trying to do is fix some of the problems in the Medicare program. The Medicare program has perverse incentives, and those perverse incentives have actually encouraged pharma to increase their prices. I can tell you from where I sit, I see all the prices of these drugs. And this year, I have seen medications go to $500,000 to almost $1 million.
I agree.
And America can't afford this anymore. And so what the president is doing is taking action. He's saying, look, if you're providing discounts overseas, then I want to make sure that America and America's seniors are getting those same discounts. It's not fair that we are shouldering the burden for innovation and research for the entire world, and the rest of the world has to pay their fair share. So that's what these proposals are all about.
I completely agree. But cutting the program and Social Security isn't the way to go about it. You can look,
and that is not what we're doing.
Oh, please go out and straighten out these people, because you can see from my perspective what I'm dealing with. I'm dealing with the headlines. By the way, I haven't even read them all today, but we're dealing with headlines.
Yeah, no, this is all about strengthening the program. And if you look at the president's record on Medicare, we've strengthened the program. For the first time, you're seeing lower premiums by 6%. We bought, over 600 new plans, new choices for our Medicare beneficiaries. And for the very first time in the Medicare program, we're allowing these Medicare Advantage plans to offer more supplemental benefits. And he's working very hard to lower their out-of-pocket expenses for their drug costs. As I've traveled across the nation and I talk to seniors and I hear their concerns, and this is one of their very, very top concerns. And it's a concern for me because when I look at the Medicare program, this is our fastest area of spend. And so we're taking action to lower the cost for taxpayers and lower the cost for seniors that are facing these very high out-of-pocket expenses. And what we're saying is we want the same discounts that pharma is providing overseas. We want to bring those discounts to Americans. and to America's seniors. It's not fair that we're shouldering the burden for research and innovation. This isn't going to impact access to anybody's medication, so they're going to get the same access, but they're going to be paying less for the same thing.
You know, the president is the most powerful man. The president is the most powerful man. We've watched him go after China. We've watched literally and try to make just an injustice that's been in place in our trade dealings for decades. This is no different. Why cut us and not go after our trade and say, I am going to open up the doorways for the United States to be able to import these lower drugs? So let me tell you from the survey that we took that what this will solve. And I hope you can talk to the president. It solves two things. One, it gets the drugs in here at a lower rate. But here's the real bonus. It gets innovative drugs in here. For example, in Germany, what they're doing with Verma and IVs and cancer, it gets the innovative in here. So for fair trade, and this president is a megastar when it comes to fair trade, why deviate now from what he has done so well? And why not say, as of January 1st, please, federal FDA, get ready. I am opening up the doorways for countries like, you mentioned Belgium. Belgium has got it going on. Belgium. I don't want to say Ireland because they don't have a good health program. But Belgium, Australia, and even Canada, and even Mexico, by the way. The innovation that's going on, if the president would open those doors just in the same spirit that he has done with knocking the heck out of these crazy tariffs, oh my God, no cuts to Medicare. People would be able to get more services. And by the way, how about looking at the holistic and alternative services? That's what came from our listenership. That pretty much equates to, we get 5.5 million hits on our website. So I want to know if that's even possible. You see what I mean?
Absolutely. Well, the first thing I would say that prices are important, but safety is even more important.
Yes,
and when we have importation, we can't guarantee safety. And so if you're taking a medication, you want to make sure that it has been produced under the safest conditions and that it's met the quality standards that Americans can count on when they know that it's being produced in the United States. So that's the problem with importation.
Oh, okay, but wait,
so I think that
just
the proposal that we've...
Yeah, wait just 1 minute, though. I'm saying if you look at the countries that you used in your study, I would imagine that you did not do this study that have drugs that are not safe. If you only look at the countries that you used in this study, they don't fit in that boat. I would imagine that you're not doing a study about lower drugs in countries that don't produce them safely. So if you only look at those countries, maybe 3 of them, maybe 5 of them, and say, you people are doing a great job, we can do business with you, let the president make the deal of his lifetime. I challenge him to do that.
Yeah, so we can't guarantee safety. I think when we did this study, we compared prices for the same drugs, the same medications that are produced here, and we compare them to what they're being provided overseas and what the costs were overseas.
Yeah.
And what we saw is that America was paying more, 180, 400% more.
But
the issue with importation is one of safety. But bringing in medications that we don't know that meet our safety standards, I think, makes patients vulnerable.
But why
if they take a medication that hasn't been produced under the optimal, that's going to hurt their safety.
But then
that's going to hurt safety. We cannot guarantee safety with importation.
I get it. But
the study compared costs.
But you can't compare costs and not include safety. Because if you're comparing drugs that come in that are unsafe and saying we need to cut to get down to those levels, then really what you're saying is we're going to cut safety here. See, I'm a researcher.
Yeah, the issue is we can't assess safety. So when we did that report, we were looking at prices because we can't assess safety, and I think that's the issue, right? We can't assess the strength, the safety, the quality of medications that are made overseas. And that's the problem with importation, because you're right, we can't assess that.
But you shouldn't have issued the report.
And that's why...
Look, I agree with you.
The report... The report was only geared at looking at pricing. We were looking at pricing to say, these are the same medications that are produced in America and produced overseas.
And didn't look at the whole picture. Because if you add the safety
factor... The president has not made any cuts to Medicare. The president has done everything that he can to strengthen the program.
Right, but
everything that he's done to strengthen the program, first time you're seeing premiums that are lower.
Basis. Look, all I'm asking you to do is you got to do it on apples to apples. If you say the costs are lower, then you should have a caveat that says, and by the way, the cost is lower for unsafe drugs. Otherwise, we should be able to import them. I'm just giving you
this is an apples-to-apples comparison. We are looking for the exact same drugs that are produced in the United States, sold overseas, and they're sold at a lower cost.
But they're not
exact same drugs.
They're not
180 and 400% more.
But they're not verified as safe.
These are medications that are produced over here. And so we're looking at the cost that pharma is charging.
I'm an award-winning researcher, and I will tell you that whenever you have a result of a study, you have to put the caveat in the study before you go out into the newsreel with what's being said and say, yes, the costs are lower, but we did not validate the safety of these drugs. So therefore, we cannot look.
The study wasn't designed to look at safety. We were just looking at pricing. We wanted to get a sense of how much, but we hear all the time. And so leave the study aside, right?
I feel
we
bad
hear
for you guys.
all the time from seniors that they can get medications overseas, the same medications, and they see that it's a lower cost drug. And we hear those stories time and time again. We hear people driving up to Canada to get a lower price medication. And that's not fair. I mean, the reality is there are the same medications that are available in other countries for a much lower cost. And that's what we're trying to point out. And what the study was designed to just talk about the cost, talked about, well, what is the differential, right? So that's what we were looking at. And I think it just proves something that, honestly, we've all known has been going on, which is that America's taxpayers and America's seniors have been paying more for the same medications, it's not fair.
It's not
the
same
medication.
We need to do something. It's not the same. When you say that the medication abroad is not safe, Americans are paying more for safe medication. That's what the report should have said. And honestly, the pharmaceutical companies have a ton of money. They are going to be all over this. And I hope that you take this back, because we have studied this for 5 years with millions of listeners in this country. And they are not really happy about cutting Medicare because of costs for drug analysis that you all did on countries that are not safe.
We're not cutting Medicare under any way, shape, or form. The only thing that we've done here is strengthen the program.
Thank you. Thank you. That's really the bottom line. So that's what we are really glad to hear. But please, if you have any influence whatsoever, please stop the politicians from using your report to say those cut costs are going to give us an equally safe cost cut here, because you cannot compare apples and oranges. And that's what I love about what you're bringing. If it's not going to affect how people are getting care, people over 65. I mean, I just visited a 97-year-old aunt. Do you think that she is going to be able to get through the myriad of what's going on here when she walks into her doctor's office and she doesn't understand why she can't get the same IV for her bone marrow cancer? They're not. So I know you've got a big job.
Yeah, they're going to get lower prices. Let me give you an example of how this may work, right? So let's say a drug that some cancer patients are taking to fight infections, right? Currently costs Medicare $4,700 for each dose, while wealthy peers in other countries are paying an average of just $1,100 for the same drug. So $4,700 versus $1,100. Under the president's proposal, the price that we would pay would go under to $1,400 a dose. And so just at 1 year into the implementation, under the proposal, the patient would already be saving $175 each time they get the drug. And by year 5, their coinsurance would be more than $600 lower. That's what we're talking about, right?
Awesome.
So they're going to have the same access to the medications that they've been having, but their out-of-pocket expenses are going to be lower. And that is what this proposal is all about. It's basically saying we want the same good deal that's being provided overseas. We want that same good deal for American taxpayers and America's seniors that are on the Medicare program.
All
we
I'm
want to lower their out-of-pocket expenses.
All I'm asking you to do is prorate those lower costs by adding a safety coherent into your equation so that you are comparing apples and apples. That's what we're saying. Then when you do that,
and we're not going to import drugs because we are very concerned. We cannot guarantee the safety and quality of medications. So we're going to be we just want to make sure that for the same medications that America's seniors are getting the best possible deal. And we want the same discounts that are being provided overseas.
Are you willing to put a sentence or a statement in your report that really lets the public know that this is not a one-on-one comparison, that the safety factor was not put in to consideration for the report? I'm not asking you to change
the study was
reports.
never designed. The study wasn't designed to look at safety. The study was designed to just look at the
costs.
Prices and the differences in the prices.
But that's not what our president
the study was
is doing.
designed to do.
That's not what a president is doing.
The president is lowering prices for seniors. That is what the president is doing. He has shown that. If you look at the Medicare Advantage program today, we're in the middle of open enrollment, and seniors all across the nation are pleasantly surprised that they're seeing their rates go down for the first time in 5 years. You're seeing rates that have gone down by 6%. He's bringing more supplemental benefits. For the very first time, people can get things like in-home care, meal services, a ride to the doctor's office. So, very historic time in the Medicare program. For the very first time, you're seeing some major moves to strengthen this program and lower out-of-pocket expenses for
beneficiaries. Totally agree with you. The countries that were included are United States, France, Portugal, Austria, Germany, Slovakia, Belgium, Greece, Spain, Canada, Ireland, Sweden, the Czech Republic, Italy, United Kingdom, Finland, and Japan. Those were the countries. And of these countries, there are countries in here, especially Canada and a couple of others, that are on socialistic systems. And those drugs are subsidized by the government. So, please, take the message back.
And they're subsidized by us. I think they're subsidized by those socialized countries. Their drugs are subsidized by us. People talk about how healthcare generally costs more, that we're spending more, and it's because we're subsidizing those countries.
I know. Stop
We're subsidizing those countries.
Don't cut our Medicare. Stop subsidizing other countries. He just did it with the tariff. Why don't we apply the same President Trump logic that he was so brilliant on with a trade agreement? Why doesn't he do it here? I agree. I think we ought to just stop the subsidies and start to look at the best solution for all Americans. I want to thank you so much for joining us here today and giving us some insight into what this international cost index analysis was all about. And I think all of us want to know how we all can create a system here in the United States that offers the best health care in the world for the best prices. And that means safe drugs, great prices for all.
The preceding audio was via a Skype call.